stroke kills twice as many women as breast cancer every year. But according to the National Stroke Association, only 27% of women could name more than 2 of the 6 primary stroke symptoms.
Robin Clanton, System Director of Managed Care Finance for Baptist Memorial Healthcare, was sleepless in Seattle on the final night of her honeymoon.
I woke up probably at 2 o'clock in the morning and thought I was having the bad hotel dream, where you wake up and you wonder, where am I? Who am I?
But because a family member of a co-worker had suffered a stroke, she knew enough to call the emergency room of a local hospital. They told her she was having an unexplained neurological event and should get to the nearest facility. She thought she had enough time to take a cab to the hospital.
Put my socks on, put my right shoe on, and then I fell down, became really nauseated, and it was like drapes were closing on my eyes. So at that point, my husband said, "Sorry, I'm calling an ambulance."
After a CT and an MRI scan, they knew she had suffered a stroke, even though she was relatively young and didn't have any obvious pre-existing conditions. But there are signs of stroke that should lead to quick response.
So a couple of the things that you can look for are in the acronym F.A.S.T, and the American Heart Association has put that out as a word that people can use to remember.
The sooner they get to the hospital, the sooner they'll get treatment, and that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
The F in the acronym stands for face. Ask a person to smile. If one side of the face is drooping or numb, it could be a stroke. A is arm weakness. Ask them to raise both arms. If one drifts down, there could be a problem.
And then S in the word FAST stands for speech. And so another common sign of a stroke would be slurred speech, garbled speech, words that come out of the person's mouth that really don't make any sense at all, or sometimes the person can't even talk.
My words were jumbled. They were jumbled for like 24 hours. So that was really scary. But the whole time I was mentally aware of what I wanted to say.
In her case, her quick response helped her recovery. There's a 3-hour window for treatment with a clot-busting drug called TPA, tissue plasminogen activator. A longer delay can lead to more permanent damage.
That's what the T in that acronym means, and that's time. So when you think someone's having a stroke, the most important thing to do, call 911, get them to the hospital.
Robin went through physical, occupational, and speech therapy in Seattle and Memphis. It turned out that a hole between the chambers of her heart was the likely cause of the stroke. Everyone is born with that hole, but it closes as most people age. And one of her symptoms, nausea, is a sign of stroke that can be particular to one gender.
The symptoms are generally the same for both men and women, but women can have some variations and a little bit of differences. So generalized weakness, nausea, even hiccups you may see as a sign of a stroke in a woman, which would not be normal for that in a man, perhaps.
So it's important to act fast whenever you think you see the signs of stroke. For Smart Medicine, I'm Doug Johnson.
Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get